I'm here at MBA's Secondary Markets Conference and just left the mPower stage where we had an amazing and enlightening conversation about women's health issues with Dr. Elizabeth Comen. And I am delighted to share time with Elizabeth today to talk about some of the myths that we have around women's health issues. Welcome, Dr. Comen.
Thank you for having me.
So we were talking on stage. You have a book out that's called All in Her Head, and it's the truth and talks about the history of medicine and how much further we have to go for women's health and why women's health issues are so important.
Yes.
So in the book, you have seen and treated thousands of women, and you've noticed some myths that we have about women's health. So we're here to debunk some of those today.
Yes.
So myth number one, heart disease affects older women.
Well, it's definitely not true. We know that heart disease is the #1 killer of women. Women can have issues after pregnancy. It's not just in older years. But I think it also speaks to the point that we are not small men. And so much of the history of women's health and women's medicine and what we know has been built on the 70-kilogram man and then just assuming that women are smaller versions of that. When we know we metabolize diseases different, or when we metabolize drugs differently, we present with diseases differently. Unique diseases may be only in women, and they may be predominantly in either women or men. And so there's so much that we need to unpack and understand in these myths.
Myth number two, women need less sex than men.
This is definitely a myth, and I would not say that we can comment on sexual desire in men uniformly or women, but I can say that throughout the history of women's health, it is extraordinary how much has been attributed to either the lack of desire or too much desire, and that's what has caused different ailments, from whether it's having asthma to scoliosis to infertility. It's really extraordinary, and they may seem like crazy, wild, bizarre stories in my book, but the reality is it was not that long ago. And then when we think about how much we shame women and don't talk about sexuality and libido in medical spaces, it's really, we haven't advanced that far.
Right. Well, for women, it was a taboo subject for so
long.
It
still is. In many settings, it still is. And there are a lot of women that are suffering in shame and not having the space to talk about whatever their needs may be.
Right. No. And I think your book is amazing because not only you tell stories about women that you've treated, but also the history behind how medicine has gotten us to where we are today, or the lack of where we are today.
Well, I think if you look at all our healthcare information today, everyone's looking for that quick fix or that quick piece of advice, the 10-step guide to what's going to make you better. But the reality is there's no perfect playbook or blueprint for how to make yourself better unless you understand what are the obstacles that hold you back. And for women, there's a lot of stories that we need to unpack there from our history, from our culture, from our religion, from our families. And only when we begin to do that can we truly understand what's the better path for our own individual health.
Right. We are one of one.
Exactly.
Right?
Exactly.
Myth number 3, you need to see a gynecologist when you're at a reproductive age.
Well, if you look at the history of medicine and women's health in this country, the assumption is that all of women's health is gynecology and that the primary purpose of women is to reproduce. But when girls are younger, they need to see a gynecologist potentially for menstrual irregularities, pain, potentially talking about birth control. But it is not just about fertility that women need to see a gynecologist for.
And on the other end of the spectrum, menopause starts later in life.
Well, menopause can start differently for women at different ages. And what is later in life anyway? How do we define older age, right? I think we're definitely turning back the clock in lots of different ways. And obviously perimenopause and the years that precede actual menopause is finally coming to light. And menopause is really defined as not having a period for a year or longer. But there are other symptoms and issues that women can face in the many years before that last period. And we need to be mindful of the issues that women may be facing during that time period.
It's so true. Well, this isn't a myth, but it is something that happens to women all the time. We may have a symptom or feel like something's not right with us, and we seek medical attention. We're told it's all in our head, or we have low thresholds of pain. And you shared with us on stage, what should women do as far as seeking second opinions, because it's hard for us sometimes
is.
to challenge our medical professional.
Exactly, and there's study after study that shows it's not just older women, but younger women between the ages of 18 and 36. Many of those women feel dismissed, shamed, blamed for whatever they may be going to the doctor for, when we know there's so many massive gaps in our healthcare system. So it's not understandable. It is understandable why women may be jumping from doctor to doctor and feeling dismissed. There's a reason why the title of the book, All in Her Head, resonates with so many women. And I would say that if you feel like you're not getting the answers that you need, come with a list of questions. Ask the doctor, what can we tackle in this appointment today? Who are the people that are going to be giving information back to me? Is it going to be a doctor? Is it going to be a nurse? Is it going to be a nurse practitioner? And most importantly, if you don't trust your doctor, if you feel like they don't like you or you don't have a good relationship with them, you have to feel empowered to find a new doctor. And if that doctor doesn't want you to have a second opinion, they're not the right doctor for you.
Well, you have great advice and so much more to tell us, and I am excited to have you join us at Empowering You in October, where we can continue this conversation. Thank you so much, Elizabeth, for being with me today.
Thank you for having me.